It's International Women's Day. It's also Endometriosis Awareness Month, Minister. And endometriosis is a hugely debilitating disease. Women who experience this disease have often crippling pain, fatigue, loss of body confidence, and the inability to work, to play sport, participate in hobbies for many, many days in various different times of the month, Minister. And in fact, this disease affects 1 in 10 women. There are more women who suffer from this disease than there are sufferers of diabetes. And despite this huge level of people and women who suffer, many suffer in silence. And they suffer in silence because there is a huge lack of information, and we have no national framework to deal with this disease. And as a result of this vacuum of information, GPs often don't have the tools and the referral pathway to effectively treat their patients. And in some cases, the pill is prescribed, and that has a positive impact around their symptoms. But the consequence of this, and the flip side, is that it actually has a masking effect. And because of this masking effect, oftentimes women in this country only realize they have endometriosis later in life, in their 30s, when they wish to start families, etc. And because of this delayed diagnosis, it is impacting significantly infertility for many women. So, Minister, it's unacceptable. Deputies, please, if I could finish. It's unacceptable that women in their 30s have to wait so long for a proper diagnosis. It is unfair and it is wrong. And also, Minister, 44% of women undergoing IVF are actually silent sufferers of endometriosis. We must address this. We need to ensure that the national framework happens. Endometriosis Association of Ireland are doing great work, but right now there's no pathway. And it's causing major difficulties. So, Minister, we really need to ensure that we have a national framework. The framework should address issues around education, awareness, a pathway referral system for GPs and specialists who are trained in dealing with this. Many women are actually going abroad to access treatment because we don't have any, significant facilities in this country. So, Minister, I would really urge you to ensure that the framework happens. It happens in a speedy fashion because it's unacceptable that women have to wait well into their 30s in some cases before they realise they are diagnosed with this disease.